Patients often approach shoulder surgery with fear of the pain. Many patients know someone who went through shoulder surgery and complained about how bad it hurt. As a shoulder surgeon, I have put a great deal of effort on reducing and controlling pain for my patients. In the past, that usually meant opioids like oxycodone. The problem is, opioids work, but they also come with a lot of side effects like constipation, nausea, loss of balance, and of course, concerns about dependence and addiction. And honestly, a lot of patients just hate how they feel when they're on narcotics. So when a new non-opioid medication called Journavx became available, we were very interested. Now, I want to be very clear, I'm not sponsored by Journavx. I have no financial relationship with the company and nobody paid us to prescribe it or to talk about it. This is simply our real-world experience using it in actual shoulder surgery patients. What caught my attention was that this drug works differently than opioids. Instead of working mainly in the brain the way narcotics do, it blocks pain signals more at the level of the nerves themselves. And when the FDA approved it, it honestly felt like one of the first truly new non-opioid pain medications we've seen in a long time. So in October of 2025, we started using Journavx as part of our first-line recovery protocol for shoulder surgery patients. Importantly, we didn't just swap one medication for another. Pain control after surgery is rarely just about one magic pill. Our patients also receive Tylenol, magnesium glycinate, which can help calm nerve signaling, and our standard multimodal recovery approach. And patients still had access to opioid medications if they truly needed them. We're not trying to make people suffer through surgery with no pain control. The goal was simply to reduce how dependent recovery was on narcotics. So we tracked our results. We compared patients from before October 2025 to patients after we started using the new pain protocol with Journavx. And honestly, the findings surprised me. The patients taking Journavx actually used less opioid medication after surgery while also reporting lower pain scores at their 1-week follow-up visit. That's important because usually there's a trade-off. Like normally if you reduce opioid use, you would expect patients to hurt more. But that's not what we saw. And what also got my attention was there was no increase in side effects. In fact, there was a slight trend towards lower side effects in patients taking Journavx. Now, this study has not yet been published, so these are still early findings from our own practice without peer review yet. But I think it points towards something really important. Post-operative pain management is changing. We still have not gotten rid of pain completely, but this represents a big step in the right direction. For decades, opioids were basically the foundation of pain control after orthopedic surgery. I'm not sure that's going to be true moving forward, and I honestly think that's a very good thing. Thanks for watching. If you feel that this video will help somebody, please share it so that they can benefit from the information too.